Thank you all so much for coming out tonight. If anybody feels like they need to have a seat throughout this program tonight, we have chairs up here. Please come and make yourself comfortable in the chairs as we go through this. First of all, I want to say thank you to Carla and Dr. Ragavan for believing in me, coming down here for 90 days, 14 months ago, to help make this happen. I've had a lot of support from them, as well as my other administration team from Charlotte, as well as all of you guys here locally. I think that this cancer center is a gem that we are buffing it out. There's so much potential in this community for a cancer center, and we're going to continue to grow it as we continue to go forward. But it's not about me, and it's not about them. It's really about our patients in this community. It's what they need in our community. But what makes it work is my staff. So I'm going to ask my staff to come up here. So tonight, after we get through with this, you want to take a tour, please ask one of them to give you a tour. But the best tour guide is Lee Brown. Come on, Lee. By default. So y'all come on up here. So Lee is one of my pharmacists. Amy Jenkins. Tiffany is our farm tech. Jonathan, Sherry, Donna, Anita, Stephanie. Is everybody? Is that everybody? Am I missing anybody? And Lynn is down there at the end. She's going to be our newest addition come July the 18th. She's going to be our breast health educator for our community. She's going to be going out and doing a lot of breast education and getting these women to come in and get their mammograms in the community. It's something that's vital for our community. So she's going to be our newest addition here within a month. So with that being said, I'm going to turn it over to Carla so she can talk about Columbus Regional. So thank you all for coming out tonight and showing your support for our cancer center.
Good evening, and I have the great pleasure of being the CEO of Columbus Regional Healthcare System, an honor that was bestowed upon me in February of 2015, and it's been an amazing 18 months. So I can't begin to tell you how happy and proud I am to be here tonight. What I really want to do, I have the great pleasure of just saying thank you. Thank you to probably everyone in this rotunda who has had a part of bringing this cancer center to Columbus County. So give yourselves a round of applause, please. I especially want to thank Lisa Thomas. I want to thank Terry Priest. Where are you, Terry? Who really helped pull this event together tonight. I want to thank the great team at the Cancer Center. I want to thank Dr. Fink, who has been an amazing addition to this community and to this cancer program here. We have a couple of board members here. Without our board, without the support of our board, we wouldn't be able to accomplish any of our objectives. I know Frida Gore, our board chair, is here. Thank you, Frida. Buddy Bird, I think I saw you, Buddy, come in. Thank you, Buddy, for being here. Do we have any other board members that I didn't recognize? And we may have some elected officials here tonight as well, so I want to thank them for their support. This cancer center didn't come together just with our clinical support. We had great help from facilities and engineering, from our dietary services, from our engineering and facilities partners, from our partners at Carolina's Healthcare System, who have been here every step of the way for us. On a personal note, I want to thank my mom, who is here tonight with me, Arlene Parker, my biggest supporter, and her friend, Don Stroop. Thank you, Don, for being here. And my husband, Bill Hollis, is here. Yep, he's probably hiding around the corner. Thank you, Bill. And we have a fantastic team of employees. So really honored to share this evening with you. The Cancer Center here has been a dream in this community for many years. And the seeds of that dream were sowed when Dr. Donayre and his family so generously donated a building to us for us to really bring cancer services to Columbus County, to bring that dream to fruition. And we are so proud of that. And we are so honored here tonight to have Dr. Donayre and his lovely wife with us here. And I want to thank you, Dr. Donayre, and I'd like to invite you to join me up here, please. because without you, this wouldn't be possible. So thank you. Thank you very much. And at this point in time, I'm going to ask Dr. Donayre to make a few comments because it was really his vision.
I'm sorry to say we all have to wear glasses.
I'm wearing them too, Dr. Donayre.
That made me feel better. Ladies and gentlemen, in 2005, when the hospital board and the administration decided to establish the cancer center, it was brought to my attention that the building to be used for that purpose was not big enough to provide the services required, including an on-site pharmacy for the dispensing of drugs needed to treat the patients, of course. Is that when our family decided to be part of providing this very much needed service to our community by making the donation of my office building to the hospital. With these several philanthropic endeavors that our family has been involved with, this has been the most rewarding and indeed the most humbling contribution that we have made. To this day, we receive and continue to receive many letters and personal expressions of gratitude from all people from different walks of life for their willingness to be or help in making the access to treatment of this dreaded disease for the people of this country in a very difficult time of their lives. My wife and I were brought up with the commitment to always help our fellow man, and to give back to our community in the best possible way. This is also what we have taught to our two sons, who were very happy to be a part of this decision in order for our hospital to continue to make available the best possible medical care. From the very beginning, I have repeatedly stated to the hospital board and to the foundation board, of which I happen to be the board member, my hope that the Donayre Cancer Center, which is providing excellent care, will continue to expand and offer every new treatment available, including radiotherapy for the cancer patient in the best convenient way. The Donayre Cancer Center is yours, as well as this hospital. If there is anything that you need or that you think will continue to improve the care that is given to you, or any suggestions to improve the care that you receive, please let our excellent CEOs know your concern. Ms. Willing is doing an excellent job, and we know that she has in her heart the best interest for this community. On a personal basis, our family is most grateful to the medical staff, to the multitude of organizations for the community, churches, civic clubs, and volunteers who, in conjunction with the excellent public relations of the staff of the Donayre Cancer Care Center, for their support and contributions at the initial opening in 2005, which established the foundation for the success that we now have. Please fulfill certainly the wish of the Board of Trustees and the wishes of our family. on behalf of myself and my family, I wish to thank you for attending this ceremony. And again, thank you very much for the support that you have always offered to this hospital.
Dr. Donayre, on behalf of the hospital, our board, and this community, I want to share with you my gratitude, our eternal gratitude, for without you and your family, this evening would not be possible. So thank you. Thank you very much. I now have the distinct pleasure of introducing Dr. Ragavan, who is the president of the Levine Cancer Institute in Charlotte. We are so fortunate to have the partnership of the Levine Cancer Institute here. It gives us the access to world-class cancer care, multidisciplinary treatment, clinical trials that otherwise we would never have access to. Dr. Ragavan is a nationally and internationally recognized oncologist. He was actually, when I came to work for Carolina's healthcare system in Columbus Regional, I think on my second day on the job, he was one of the first people I had an opportunity to meet. And I had the distinguished opportunity to have lunch with him. And it was his passion, it was his belief that in fact we could provide cancer care outside of the walls of Charlotte, of Mecklenburg County, and we could bring it to communities like Columbus County. The citizens of this community deserve the very best, and the very best is what we're going to deliver. And we're going to deliver that with our partnership with the Levine Cancer Institute. So at this moment, I'd like to introduce Dr. Ragavan and ask him to make a few comments.
Hi, folks. It's a great pleasure to be here. And as a mark of our respect for Dr. Donayre and his family, several of my leaders have come down from Charlotte. So Ed Kim, who joined me from the MD Anderson, leads our solid tumor group. We've got Ed Copeland, who came with me from the Cleveland Clinic. He leads our hematologic oncology team. We have Donna Field, who's our assistant chief of pharmacy. We have someone known as the King. His name is Mark King, who heads our clinical trials operations, several of our administrative leaders. So, you know, the Levine group actually cares about what's happening down here. I think one of the things that we agreed was critically important was that the Donayre family name remained the leading name in this cancer center. Dr. Donayre and his family actually allowed this to happen, and we appreciate so much the ability to develop a partnership. For me, it's kind of nice to see someone who has been so philanthropic and whose name is associated with philanthropy in the Whiteville area linked with another great philanthropist who grew up in Rockingham, my friend Leon Levine. And so having two generous and altruistic people's names associated with the cancer center, I think, is great. Carla Hollis and I have had a partnership now for some time. I want you, when the ceremony is over, to remember that we need to sing happy birthday to her because it is her birthday. If it's a perfect birthday, there'll be a red velvet birthday cake, but if not, she still has this beautiful facility. I think the gift that keeps on giving is one that our team gave to you, which is Lisa Thomas, who ran our chemotherapy resource for several years, is one of the most knowledgeable chemotherapy nurses and cancer nurses that I know. And when we talked about the renaissance of the operation here, I thought that Lisa would be perfect. And as she said, she came for a few months and obviously loves it and has stayed on and has grown to be part of the system here. The final piece, and I think he gets to talk in a moment, is Ken Fink. And Ken was the product of a long search to get the right fit for an oncologist who both has served his country, served the population, understands clinical trials, and is able to relate well to our leadership and clinical team. Carla was right. We've imported about 70 oncologists to the Charlotte area and North and South Carolina, and added the best and bravest and finest oncologists that we could find from North Carolina, and Ken obviously is one of those. So we now have a team that exceeds 120 cancer specialists. We have regular tumor discussions, conferences, and so on, and this new facility will enable Ken and the physicians here to participate in everything we do to bring clinical trials here. Our mantra is that we serve the population at home wherever we can. So I just congratulate you, Carla and Lisa, and your teams on achieving this. We're honored to have second billing to Dr. Donayre and his family. I think it's very important to work with the local culture and the local experience and philanthropy. I can assure you that we will be there in partnership with you to make this the best small cancer center as part of a big cancer center in the nation. And I think you'll find that we don't let you down, and we look forward to serving you for the millennia to come. We appreciate being part of this, and thank you for the opportunity of joining you in partnership.
So when I came down last April, one of the first challenges I was given was to recruit a physician to the community. After Carla and I looked through multiple resumes, CVs, we ran across Dr. Fink, and he started with us in November, and he has been a great addition to this community. If you've not heard about Dr. Fink, please get out and hear about Dr. Fink. Patients are loving him. My staff love him. They respect him. He has just been a great blend to the LCI culture here in Columbus County. So with that being said, I am welcoming Dr. Fink up here to say a few words.
Well, what an honor. Thank you so much. I've never heard such good comments about myself from so many nice people. Well, let me, I did write my comments down because it's really hard to keep a straight head at this moment. But Lisa, Ms. Hollis, Dr. Donayre, Dr. Ragavan, Dr. Kim, Dr. Copeland, thank you, and co-workers, friends, colleagues. I'd like to thank all of you really so much for attending today's ceremony to honor the opening of this fantastic new clinic. It's so beautiful, and it's dedicated to what we love here, to the treatment of patients with cancer and blood disorders. That's what we're here for this community. I really feel very honored and humbled by all the efforts that really have gone into the creation of this facility. It was quite an undertaking. I'm grateful to all the workers who put not only their backs but their minds. I mean, just the design and the beauty of this place. You can see a lot went into its conception and construction. Well, I've now been here for 8 months. I'm very honored, really, to be its medical director, but I still feel like the newcomer here. I was, of all the people, the staff you met, I am the newest one here. One thing, we started out on the 4th floor of the hospital. It was a bit of a makeshift place, but it was there, and we took care of business up there. But this place as really what a change in our environment. One thing, even though our environment is so much better now, one thing that has not changed is really the capability, the expertise of the staff I'm working with. And really it's a real pleasure to work with Lisa and your staff. This is the best staff I've ever worked with. I'll admit it took me a few weeks to get everyone's names down. I wrote them down a few times and got a few people mixed up, but this is a crew of people I would work with anywhere. You could put me in any location, I'll work with them. They're fantastic. And really in Columbus County, I feel now is a healthier place thanks to projects like this, thanks to the people that work not only at the Donayre Cancer Clinic, but also the entire Columbus Regional Medical Center, which now it can really boast a top-notch cancer center. We've really got the location to show for it. And in addition, with many other high-level capabilities throughout this facility. Salas, I really want to thank you for really creating a culture of health in this county, which is no longer the least healthy county in North Carolina, really. And it's really thanks to the culture I think you've created at this facility. Also, I'd like to thank Dr. Donayre. Your original vision of bringing this cancer care to Columbus County has really made it possible for the citizens of this area to only have to travel a short distance to get their treatment for these complicated diseases that we care for. And I also, they're not here, but thanks to all the people who preceded me in really firmly establishing the Donayre Cancer Center and carrying out this mission. So my job has really become easy. I just come to work, take care of people, although their problems are very tough and they have tough health problems. And the difficulty of getting people through these diseases and this treatment is just, it's not easy. But thanks to this new facility, I do believe our patients are going to have a much better experience and have a lot more comfort in their care for these difficult times that they're going through. On behalf of the entire Donayre Cancer Center, I also want to thank Dr. Ragavan and the Levine Cancer Center and Carolina Healthcare System for sponsoring this project and really taking care of us and managing us at this, I think, most remote site from Charlotte. Thank you, Dr. Ragavan and Levine Cancer Center, for being our big brother when it comes to some of the tougher patients too. I know I can rely on you to be there for the tougher patients, and I'm planning to call them from time to time when those problems come up. They're right there behind us. Finally, I want to thank the Levine Cancer Institute and Columbus Regional for putting your trust in me, and I vow to do my utmost to fulfill the vision of delivering the best cancer care possible at this beautiful facility to the well-deserving good people of Columbus County. Thank you.
So next on the program is the blessing of our new center. We want to make sure that we get it blessed. The Reverend David Carl drove all the way down from Charlotte to help us do this, and he was supposed to be joined by Jeremy Simmons, who is going to be our chaplain here at Columbus Regional, and will start next month. Unfortunately, he had a family emergency and could not leave Charlotte today. So, Reverend Carl, will you please bless our new facility?
It's my pleasure, and what a great evening. What a great partnership. And what a great understanding of what healthcare is about. If there's one thing I know about Columbus Regional Healthcare, and if there's one thing I know about the Carolinas healthcare system, is that we believe in the mind, the body, and the spirit. It takes all of that for the healing process. So it's fitting that at this moment we have a blessing, and a blessing that would somehow be befitting of this momentous occasion, would be one not with just one voice. But I want to ask you, those who would dare to share, in one word, what is your blessing for our new center? One word. Call it out. I'm listening.
Healing.
Healing.
Love.
Love.
Compassion.
Peace.
Hope.
Keep bringing it.
Faith. Encouragement. Motivation. Fun.
Dedication.
Faith. Humility.
Mercy. Gratitude.
Kindness.
Family.
And I would add justice, because it is just, it is right to have this Cancer Institute right here. Do you agree?
Yes.
That said, with the same chalice, we blessed the Levine Cancer Institute on Moorhead, so we bless this Cancer Institute in Whiteville. I'm going to get that doorway, so if you want to get wet, so it's with this holy water, we ask God's blessing upon each and every patient, each and every family member, each and every staff, each and every one of the partnerships that it takes to conquer, heal cancer in our midst. We ask this in the name of all that's holy, in all the name that's good, and all the name that brings healing and wholeness. For this we pray, It's for this that we give thanks. Amen.
So we have Terry from the chamber, and she is actually one of my favorite people in Columbus County because she runs Joe's Barbecue.
I need her all the time. And I don't think I need the microphone either. Okay. I am Terry Edmond. I am the chairperson of the board of directors of the Columbus Chamber of Commerce and Tourism. And I want to thank everyone for having us here this evening, this gorgeous facility. There are several of our board members present. If you will, just raise your hand. And I want to thank y'all for coming out and supporting this. This really touches home with me. Cancer is a horrible word. It's a horrible thing. My family has already got to use the Donayre Cancer Center, unfortunately, while it was on the 4th floor. My Aunt Janice found out she had colon cancer. She was taken such good care of. She is doing great now. This staff, like Dr. Donayre said, is awesome. Hometown care, and that's what it's about, y'all. So yes, it's very personal for us, and we want to thank you and your staff. There are some of our city officials here. Terry Mann, Mayor of Whiteville. I know Darren Curry, our town manager, is here, and some members of our town council. I was wondering, Terry, do you want to make any remarks? Okay, Terry's going to make a couple of remarks. Come on.
I don't know that I do want to make remarks. As Reverend Carl says, it is right that we have this here. There's a lot of things in the rural counties that we can't have, and this is just one more thing that Columbus Regional has done to make living in Columbus County a better place to be. And I thank them for it. I thank them for what they've done. It makes so much sense to have it here on the campus of the hospital, and I just wish everybody the best. Thank you very much. On behalf of City Manager Darren Curry and Councilman Robert Leader, I don't think any others are here, but if there's anything the City of Whiteville can do, please call on us. Thank you.
Thank you.
At this time, we would like Lisa and her staff to cut the ribbon.
Please help him. All right. Come on, Dr. Fink. Where are you? All right. Okay.
Y'all need a countdown?
Yes.
3, 2, 1.
So it's time now to enjoy tours of the Cancer Center. We've got food and all kinds of music in the garden, so please enjoy.
So one of the things that's out there in the food section is there is an ice sculpture, and it has the Columbus Regional logo and it has the Carolinas Healthcare System logo. So those two are together. We want you to enjoy. We're trying to blend those together. So please enjoy that.
We hope it hasn't melted. But
And then if somebody had a perfect birthday, there might be some red velvet cake out there.
maybe there is. Enjoy the evening. Thank you.
Thank you.